to you all. My name is Blaise I'm a student in Year 3 Biomedical Laboratory Science at Ines Ruhengeri. My reg number is 23 bar 19496. Today we are going to go through together with an assignment of applied immunology. I'm going to work on the question from question number 17 up to question number 20. Let's continue to the questions we are going to deal with. We are going to deal with the questions about the principle of vaccinations. The first question we're going to deal with, the question number 16, is ask that what makes a vaccine effective? Here we are going to see the factor that contribute to the effectiveness of a vaccine. Another question is how the messenger RNA vaccine works. Here we will know what is messenger RNA, also how they function. In the question number 18, we are going to deal why are adjuvants used in vaccines. In that question, we know what are the adjuvants and the reason why they are used in the vaccines. The question number 10, how are live attenuated vaccine prepared? On that question, we deal with the meaning of live attenuated vaccine and also how they are prepared. The last question will be the question number 20, where it asks what are the advantages of subunit vaccine. In this question, we will know what is subunit vaccine and also its advantages. Without taking more time, let's go to the question number 1. So it's question number 16. Question is, what makes a vaccine effective? Firstly, vaccine effectiveness is a measure of how well a vaccine will work in the real world. Here we measure the proportion of how the vaccine works in the real world. We can say that when a population receives the vaccine, we will see the proportion of the people who are vaccinated who will get illness and the people who will be immune to that virus or the disease. The vaccine efficacy is measured in a controlled clinical trial, and it is based on how many people who got vaccinated developed the outcome of interest, usually the disease, compared with how many people who got placebo developed the same outcome. Here on that picture, they are saying if a vaccine has an efficacy of 80%, when you are measuring the trial, after making a vaccine, you do a trial in the laboratory. So if a vaccine has 80% of efficacy, this does not mean that the vaccine will only work in 80% of the people who received the vaccine. It means that if in a vaccinated population, 80% fewer people will contract the disease when they come in contact with the virus, means that the few people will come ill when they contact with the virus. So that if they vaccinated, also they continue making the preventive procedure so that they cannot get the disease. They are the factors that contribute to the vaccine effectiveness. Firstly is the immune response activation. Here on the immune response activation, we deal with the production of antibody. You know, when after the exposure to the antigen, the body starts producing antibodies by B cells. B cells start producing antibodies. So when you are vaccinated, the vaccine triggers the immune response. So the body starts to produce antibodies against that virus or vaccine. So during the production of antibodies, also there is the development of the memory cells. The vaccine will be fought against, then it is eliminated in the body, but there is remaining of the memory cells. The target of the vaccine is those memory cells. So for the immune response activation, the vaccine will trigger the immune system, so the body will create the memory cells and also the antibodies. Other factor is the duration of immunity. For the vaccine effectiveness, we deal with the duration the immunity will last in the body. Here we can say that when you are vaccinated and you do not require another type of vaccine for that disease, or you will not encounter that disease in the future, that the vaccine is effective. They say that the effectiveness of the vaccine also depends on how long the immune protection lasts. Some vaccine provides long-term immunity, while others require booster doses to maintain the protection. Those booster doses, the other doses for that vaccine. Let's continue to another factor. Another factor is vaccine design and research. After the production of the vaccine, it is delivered to people, but also they continue making research about that vaccine. As you know, many viruses evolve day by day. Also, the vaccine may be designed differently day by day so that it can be effective always. Let's continue to another. It is proper dosage and administration. Here we deal with the dose you gave to the patient or to the person. Here they say vaccines are typically given in specific dosage and schedules. The number of doses and the timing between them are important factor in ensuring the vaccine work effectively. That's the end of the question number 16. Let's continue to the question number 17. How do messenger RNA vaccine work? Firstly, here you have to know what are messenger RNA vaccine. Messenger RNA vaccine are those vaccines that contain the messenger RNA of a virus or a bacteria. For that vaccine, they have the messenger RNA. As you know, messenger RNA is the outcome of the transcription of DNA. So when it enters in the body, messenger RNA is functioning for the protein synthesis. As you know, when the DNA is transcribed, it forms messenger RNA. Messenger RNA migrates from the nucleus to the cytoplasm so that it can enter in the ribosome for the production of protein through translation of that messenger RNA. So, messenger RNA vaccine works by teaching the body immune system to recognize and fight specific pathogens such as virus. It teaches the body how to fight against the virus by using the protein produced from that virus. It's how we can understand better the messenger RNA vaccine works. Teach the body how to fight against the virus by using the viral proteins. Let's go to the step by step about how it functions. Here we are going to see how the messenger RNA vaccine functions. Firstly, there is messenger RNA introduction. The messenger RNA vaccine mainly they are injected in the muscular tissue, in the muscle. When it is injected, it's what we say it is messenger RNA introduction. Your body is introduced to messenger RNA vaccine. During its production, that messenger it is coated with the lipid layer, so it can diffuse through the plasma membrane easily. In the, here it's come to the delivery into cell. Here the messenger RNA vaccine, which contain messenger RNA coated with the lipid layer, it is enters in the cell where it is that lipid layer is removed, so we can have the messenger RNA only. When the messenger RNA enters in the cytoplasm, it migrates to the ribosome. Here we get to the protein synthesis. For the protein synthesis, the ribosome translates the code of the messenger RNA, forming the viral protein. It is viral protein because it is not the messenger RNA from the cell, it is from outside. It is foreign protein. After the production of that protein, the body recognizes that there is the foreign particle in the system. Here it is immune system activation. After recognizing the foreign protein, the immune system it is activated. Here the B cell starts producing antibodies, and the T cells also are activated so that they can destroy those foreign proteins. After the activation of the immune system, we go to the next step, which is immunity development. For the immunity development, as you know, during the activation of the immune system, B cells produces antibodies, also produce the memory cells. Those memory cells are there in the immune development so that the, when the body encounters the virus in the future, the body will know how to react on that virus so it can be eliminated easily. The last stage is the messenger RNA breakdown. As you know, the messenger RNA is not stable. So, to be broken down is simple. It is a single stranded, so it have to be broken down to avoid the hyperprotein production. That's why they are mostly important. After their work, they are broken down and removed in the system. That's it, how they function. Let's continue on the other summary about it. We are having the other summary. During the production, as we said before, during the production of that messenger RNA vaccine, there is the extraction of the messenger RNA of the virus. It is packaged into lipid monoparticles. One messenger RNA in the lipid, covered with the lipid, as you see here, it is covered in the lipid. Then there is preparation of vaccine where we package it in the bottles, so you inject the vaccine according to the dose of that vaccine. You inject it in the muscular region, mainly at the arm, where we go to the stage of messenger RNA introduction. After the body receives the vaccine containing messenger RNA, so it enters into the cell easily because it dissolves in the lipoprotein B layer, phospholipid B layer, dissolves and enter easily. Then, when it reaches in the cell, it is encapsulated. That lipid layer is removed. Then messenger RNA moves into the cytoplasm. After moving, it reaches to the ribosome, where we have translation of that messenger RNA. It produces the protein, foreign protein. Here they call it spike protein or the viral protein. After that protein, it is exposed in the body. So the body starts to recognize that there is foreign protein produced. Then the body starts working on it. B cells start producing antibodies, Also, T cells start to be activated and remove that proteins. Here we reach to it is recognized by immune cells antibody production. Also, during antibody production, there is what we call the memory cells produced. So it is easily to be seen. Here is where it comes from that picture. Let's continue to the next question, question number 18. Why are adjuvants used in the vaccine? Why are adjuvants used in vaccine? Firstly, you have to know what are adjuvants. Many use the adjuvant is aluminium source. Also, there is other adjuvants, but firstly, let's know what are adjuvants. By definition, adjuvants are substances that, when mixed with the vaccine and injected with it increases it or enhances the immunogenicity of the antigen. So that when mixed with the antigen and injected with it, enhances the immunogenicity of the antigen. When you are having an antigen, then you want to increase its immunogenicity. You mix it with adjuvant. When it reaches in the body, that adjuvant accelerates or enhances the immunogenicity of that antigen. Adjuvants are used in vaccine to enhance immune system response to a vaccine, making a vaccine more effective. Here is why adjuvants are used in the vaccine or the importance of adjuvants. Let's see. As you see here, they are comparing the vaccine which used without adjuvants and the vaccine used with adjuvants. When that vaccine without adjuvant, it reaches in the body, it is encountered by the antigen presenting cells. Then the antigen presenting cells, they mature because they meet with that antigen. When it's reaching the lymph nodes, there is the production of the B cells that are activated. So the production of antibodies and the memory cells, but at a low rate. While when we use vaccine with adjuvants, you see there is multiple antigen presenting cells that are matured compared to those without antigen. Also, in the reaches in the lymph nodes, the there is activation of the B cells more. Also, there is the B cells, they produce antibodies at high rate because of that adjuvants used. Also, the memory cells are produced at high rate. That's why the adjuvants will be important during in that comparison. You see it. Let's continue. Here also the other reasons. When you use the antigen, there is rapid response. The body responds rapidly. Also, there is the reduced number of the antigen used. Here we use less antigen during the production of the vaccine. We use less antigen when you're using the adjuvants because it enhances its immunogenicity, so the immune response will be strong. Let's continue. Here they are explaining the reason for the using of using of the adjuvants in the vaccine. I see this is talk the immune response increase during that differentiation of the we talked about this. Reduce the amount of antigen needed. When you use antigen, you use lower dose of antigens, so it can be used in the production of vaccine for many people, while we are having the lower dose of antigen. Also, prolonged immune response. It builds specific immune pathway. That's it for the question number 18. Let's go to the question number 19. How are live attenuated vaccine prepared? During this question, firstly we will know what is live attenuated vaccine, also the example of those live attenuated vaccine. Also we deal with the how they are prepared, its preparation. Let's move to the definition of live attenuated vaccine. Those are vaccines that contain weaken the form of virus or bacteria to stimulate the immunity without causing disease. Here we use weaken the form of virus or bacteria to stimulate the immunity without causing disease. That's the definition for the attenuated vaccine. Example of those vaccines are those vaccines for measles, mumps, rubella, and chickenpox. They provide strong and long-lasting protection. As you know, the vaccine for measles, for example, we took one dose of the vaccine, so it is long-lasting protection. So let's go to its preparation. The first step in the preparation of the live attenuated vaccine, here we will require the attenuated. It contains attenuated virus or bacteria, so we require its attenuated form. Firstly, we have to isolate pathogen from the infected individual. We isolate the virus so that we can use it in the preparation of the vaccine. After isolation of that pathogen, we have to weaken the pathogen. Weakening of the pathogen is also called attenuation of that pathogen. So it cannot cause the illness. How the weakening of that pathogen is done? First, there is two ways we can do it. Firstly, we can grow it in the non-human medium or grow it in the laboratory condition. Also, we can modify genetic material of that virus. When you grow a virus in the laboratory condition, you you decrease its virulency so that it can be safe. It cannot cause the disease. After the attenuation of that virus or pathogen, you test if it is totally weakened. The attenuated vaccine is the virus. It is tested to ensure that it cannot cause severe disease but still trigger an immune response. During weakening, by the error, you can weaken the pathogen, but it will also lose the ability to trigger the immune response. So that will be for nothing. You test if it is weakened well, but also can trigger the immune response. After testing the weakened pathogen, you prepare a vaccine. As you know, the vaccine it is at high. You need the high amount of the pathogen to prepare the vaccine. So once the pathogen is safely weakened, it is cultured in the larger quantities, purified and formulated into vaccine. Next, no, for that question, the addition is that after the preparation, you prepare the vaccine, you package it, then it can be given to the people. But before the vaccine is given to people in the real world, there is some trials to be done to know the efficacy of that vaccine, to see if it cannot cause the other side effects when you use that vaccine. You test it and make the laboratory trials. It is contained in the purification of that vaccine. Let's move to question number 20. What are the advantages of subunit vaccine? What are the advantages of subunit vaccine? Firstly, we have to know what are subunit vaccine. Subunit vaccine are used in the real world, mainly used. It is mainly distributed vaccine in the world. Let's see about the definition of the subunit vaccine. Subunit vaccine are vaccines that contain only specific piece of virus or bacterium, such as protein or sugar, rather than the whole pathogen. It contains single piece or specific piece of virus, not whole pathogen. Those pieces are enough to trigger an immune response without causing the disease. Those pieces of the pathogen, they trigger immune system immune response. So as you know, when the viral protein enters the body, they are recognized as foreign, so it triggers the immune response. Here, the example of the subunit vaccine, we can have the hepatitis B vaccine. You know, hepatitis B has the surface antigens. Those are the one used in the preparation of that vaccine. There is human papilloma virus (HPV). You know it. Its vaccine. It is subunit vaccine. It contains the virus-like particle from the human papilloma virus. This is the severe disease. You know it. Let's go to the advantages of subunit vaccine. The first, it is safe. It's safety. So since they contain only part of the pathogen, they cannot cause the disease. That's where its safety comes. Another is targeted immune response. As you know, it is subunit vaccine. So they focus on a specific component like protein that triggered a strong immune response. Other is reduced side effect. Few side effects compared to live virus, as they do not involve live pathogen. Also, there is the reduction of errors. As you know, when you are using the live attenuated vaccine, you can make an error. So during the testing of the live attenuated viruses, one can escape the attenuation. If the single virus escapes the attenuation, it can lead to infection while you are vaccinating a person. Otherwise, there is no risk of immunocompromised. It is safe for people with weakened immune system, such as people with HIV. That vaccine will be better. Other is easier to store, as often more stable and easier to store than live vaccine, reducing logistical challenges. As you know, the live vaccine, you have to refrigerate the temperature condition must be respected well, so that they cannot kill the viruses inside the vaccine. See, so that's the end of my presentation. Here are some references, even though there are some others, it does not include some references. So that's the end of my presentations. Thank you all for your attention. If you are having a question about that presentation, let me know in the comment. Also, if you have some recommendation, let me know in the comment, so that next time I can talk about it. Also, if you have another addition, let me know, so that also me I can improve in day by day studies. Thank you all. Have a nice year.